Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This morning, Dr. Joorabchi, you know, you're of course, you're a medical physician and you're doing a lot of interesting things there in your office, but you also are a tech guru. And so I love this idea. Well, let's just get started. And why don't you just tell people what you do, who you are, and we'll then let you tell us a couple of things. The one thing, everybody, if you have a problem smelling things, Dr. Joorabchi has some exciting advice for you. Let's just get started now with what you're doing.
All right. Well, it's good to be back. It's good to be in the studio.
Yeah,
it's good to be. It makes me feel like I'm actually somewhat important in this great studio.
Oh, you are important.
But yeah, so I'm an ear, nose, and throat doctor, and I do allergies, and I have a special focus in sinus, snoring, allergies, and kids. And so basically been doing this for about 6.5 years. Anita, you're the first person I met.
And you know, I have to share this with everybody. You want your ears cleaned out properly, not by all these other hocus pocus stuff, and have it safe. I always go to Dr. Joorabchi. He cleans my ears out so I hear perfectly.
Yeah, you come in there. It's always great. It's a great.
Okay, so
hour.
now you have some very interesting techniques and procedures. Why don't we start with some of those?
Yeah, well, you mentioned a hot item. This is pretty fresh stuff. Basically, I have a lot of patients that don't smell. It's a common thing. As you get older, neurodegenerative disorders, it affects your sense of smell. And we really haven't had a great breakthrough with that. So one of the things we've been exploring is actually smelling essential oils. And so there's a study that came out. It was called olfactory training, where they had 4 essential oils. It was rose, eucalyptus, lemon, and cloves. So you'd put it in a jar. You'd basically smell it, gently smell it for 10 seconds twice a day. And over a period of 12 weeks, there's about a 40% recovery rate of smell. I had a doctor come to me. I get this all the time. They'll kind of pull me aside. I call it like a street side consult. He was pulling me aside in between surgery. He goes, listen, SINA, I'm not smelling. 45-year-old guy. He's like, I had this bad cold. I lost my sense of smell. I'm not tasting. I just sent him the protocol. 3 weeks. He's like, that was a game changer. It was great. He's like, I had another guy give me antibiotics and steroids. Didn't work. He's like, within that, it worked.
Tell me, but do you connect smelling with tasting? Is it similar?
Absolutely.
One.
So the first thing we look at when people have a taste disorder, we look at the smell. I put a scope in the nose, make sure there's no congestion, no mass is growing, basically anything that can block that pathway. And if there isn't, then it's a nerve thing. And nerve things are difficult. If I could heal nerves, there'd be no people in wheelchairs, no blind people, no people that couldn't hear. So the fact that we're kind of getting on this and stimulating the olfactory nerve is really compelling. So in Parkinson's and Alzheimer's, one of the first symptoms is loss of sense of smell. So this is a game changer because, you know, smell, taste, that's important quality of life factors and metrics. So a simple thing is smelling an essential oil, which is kind of taken off right now. I mean, I'm going to tell all my patients, and I want to get the word out. I'm going to make a YouTube video. I'm just getting it out there because it's simple stuff.
And you said you would maybe write an article for us in Boomer Times because I think it's important.
Yeah, absolutely.
But it just shows that you're on the cutting edge of so many things. Something else, there's a couple of other things that you're on the cutting edge of. Why don't we talk about those?
So one thing actually I didn't talk to you about was I was actually in Atlanta 2 weeks ago. So I've made a special contact with a guy I've been working with for about 6 years, and it's regarding sleep apnea and snoring. So there's this new thing where basically the tongue will fall in the back of your throat, right? And you get sleep apnea. But there's this new thing that's basically like a pacemaker for the tongue. It's called Inspire. So the biggest thing with sleep apnea, no one wants to wear the mask. What is the mask doing? It's putting air through the nose. It's putting pressure to keep the tongue forward. So imagine like you're moving outside of a car, you stick your head out the window of a moving car and it's going 10 miles an hour. You know, that's okay. But what if you need 40 miles an hour? You got to have that much force. So the Inspire helps those people out, people that don't really tolerate CPAP. And so basically it's like a mini pacemaker that goes in your chest. And there's a little electrode that goes to the chest and it senses when you stop breathing. and there's another electrode that kind of goes up to where the nerve for the tongue is, and it sends a pulse. So I think like Gene Simmons from Kiss, right? But not that aggressive. But it basically sends like a stimulating pulse to keep tension in the tongue.
But wait a minute, when you're not sleeping.
When you're sleeping.
I know, but when you're not sleeping, how do you disconnect it?
So that's a great question. That's a really good question. Basically, there's a little magnet you put on to kind of activate it, turn it off. And so sometimes people will go to work and they forget, right? You're in a jam, you got to get going, right? And then they'll halt breathing, driving, and they'll feel a pulse. There's app communication too, so there's a Bluetooth communication with it as well.
It's amazing, isn't it?
It is a game changer.
But you're right, that is a big problem. A lot of people don't want to use it. Now with all these people who are dating in their boomer ages, they don't want to have one of these pap things on when they're making love. I mean, it's
right.
Oh, you have one of those? Forget it. Used to be what's your political party? Now it's you wear a pap machine.
It's a lot. It's common because
yeah.
The problem is that as we get older, just like the tissues on our face, starts to sink, so does the tissues on our tongue and our palate. So if there's more tissue back there's more chance of collapse. With sleep apnea, when we get to REM sleep, that's like your rapid eye movement sleep. That's where your body hits the reset button and everything relaxes. But if it relaxes to the point where the airway closes off, your body starts choking, you wake up. But then your body drives you back there because it needs it. So it can become a vicious cycle. You can do this 20, 50, 107 times an hour. I had a 34-year-old guy, skinny guy, like skinny. And he had 107 apneas an hour. You look at him, how could this be? You look in his throat, and his tongue is huge. His palate is long, tonsils big. So those are all the worst things. So sleep apnea is, one of my mantras is prevent before it happens instead of reacting to what has happened. And sleep apnea is one of these things because it can cause high blood pressure, diabetes, heart attack, stroke, depression. You're at a 4 times risk of motor vehicle accident. So I've become very passionate about snoring because if there's one thing that in my practice that is, a lot of my practice is very quality of life. It's very happy. There's a lot of jokes. I can fix things pretty quickly. And that's why I love what I do.
You have such a great personality. Of course people joke with you because you make them feel so relaxed.
Yeah, I mean, it's fun. We are literally joking. I was doing a surgery on a lady and I was like, well, this is not a spa day. We're doing surgery. Wake up. And she started laughing. But this is the one hot button for me where I think I can make a difference and there's still a tangible fix. And it's just a matter of doing either the mask or doing some sort of intervention because you can prevent a lot of issues down the line. That's the whole thing.
Let's go to the sleep apnea again. How does one know that they have sleep apnea? I mean, when you do my ears, you never look at my tongue. But I sleep all night. I maybe have to get up to go to the bathroom. Right. But so would that mean that I'm not having this problem? So
the first thing, as far as what I do, a lot of it is what patients say.
Yeah.
If I look in your nose, if I see a crooked nose, I'm not going to say you have a crooked nose. I'm going to ask how your breathing is. So I'm subtly asking you questions, feeling you out. In our casual conversation, it's very tactful. So I'm a quality of life guy. If you have a crooked nose, but it's not bothering you, why am I going to push that upon you? It's not bothering your life. But with sleep apnea, there's little cues. Facial characteristics, anatomical characteristics, the way your tongue looks. You don't remember the first time I saw you, I graded your palate and your tongue. And there's a grade. And so I have that document in our first visit.
Really? I didn't know that you did sneak that in on me. I didn't know that. Oh my God.
So then if the relationship is really bad, that's the one thing, because that's not quality of life, I will start probing. And I'll go, how do you sleep? Do you snore? Are you well rested? Do you have blood pressure issues? Has your spouse or significant other said anything about your quality of sleep at night? And that usually will tease off something. The next step is getting objective data. We got to see if you're actually snoring, if you're actually having apneas, and how bad. But it first starts either what I say or what I see or what you say, then we start going from there.
It's interesting because I do know couples who they don't sleep in the same room together, and I asked them why. They said because he snores or she snores. That's a terrible thing, isn't it?
It is.
That you now aren't even with each other?
I wish
that's
there
what
was an
you're
easy
talking about.
fix for snoring. I really
But
wish.
it sounds like you
yeah.
have something now that is possible,
Right.
but you have to, and we'll go back into
Yeah.
that another time. So that's one thing, the
You're
sleep apnea. There was something else that you talked about when your nose drips.
Right. So that's another hot button item. So again, I'm the happy guy. I make people happy. That's why I love what I do. So and I like making people happy with very easy things. Cleaning wax, right? Treating infections. So nasal drip is one of these things. 60 million people have nasal drip in the United States. 60 million people. So I have a friend in Stanford, and it was a casual conversation about 4 years ago. And I was like, man, I have these people that have this nasal drip. They'll drip out of nowhere, drip with just eating, drip with allergy, and these sprays don't always work. What is the next step? What are you guys doing in Stanford? He goes, well, it's funny you ask. We came up with this little instrument, a little balloon. You put it in the back of the nose. You freeze a nerve. You just activate a freeze button for 30 seconds. Do it on both sides, and that's it. I'm like, what do you mean? He's like, it's a posterior nasal neurectomy applied with cryoablation. And he started doctor talk with me.
Right.
Basically, the premise is this. So we've been doing this procedure for 50 years. We actually cut the nerve responsible for the drip. But they found in Stanford that basically if they put a little balloon where this nerve is in the nose for 30 seconds, it achieves that result in 80% of people. And it's something we can do in the office. It's painless, no downtime. So it's a game changer. But, it's just a matter of, do you want to spend the time to go through a procedure with me? And I got to take about 30 minutes to numb you. And I don't have to give you any shots. I put a little numbing cotton pledge in the nose, let it cook. We're joking, listen to music, put the balloon in there, freeze one side, freeze the other side. In about a month, you're going to know if it's going to work. So 80% of people, so it's not perfect. I've had people that have failed, absolutely. But 80% change their lives. That's what I love when I do. When I see that, it's an easy fix.
And
And boom, you see it. I had a police officer. I had a GI doctor. She keeps scoping people and sniffing constantly. And these little things. I have a close friend. He's a big guy in Boca. I'm going to do his. We're going to set up a Saturday, go to my office. We're going to do it.
He has a dripping nose.
Yeah.
See, I can't even picture that. So, like, I'm sitting here now, and all of a sudden there would be a drip coming from my nose.
You're doing
people
you're doing
who do
that a
that.
lot. Right. You're doing the sniffing a lot. And it's one of these things where you become conscious of it. And a lot of these things, you may be more conscious than other people, but then it depends. Imagine, Anita, if you were sniffing constantly on the radio.
I couldn't. I couldn't do what I do.
And then it would kill the quality of
Yes.
life. So if I can just put a little balloon and freeze it
I
for
think
30
this
seconds,
is fabulous idea.
why not?
Oh, any of you sniffers out there, I want you to go to Dr. SINA JOORABCHI. That's JOORABCHI, Dr. SINA, and he's over there in Pembroke Pines. I'm going to give you the office phone number. Get your pencils out. Remember, this is Pencil Talk Radio. It's 954-438-7171. That's 438-7171. It's 954. Make sure that you ask for Dr. JOORABCHI. Right now, there are only two of them, Dr. Shapiro and Dr. JOORABCHI.
We do have a PA.
Okay.
Sharon Cam. She joined us about a year ago.
Okay.
And she's actually been in the field for about 5 years. And she's great. And she basically is capable of all ear, nose, and throat conditions. So I do want to make a plug for her.
Okay. And also, of course, there's no one that I could recommend more highly than to have your hearing tested there. They've done it when my husband was alive. That's where we went with him, and I drove from Boynton, and I do that, Boynton down to Pembroke, because people say things are so far. I said, well, if you're going to go shopping at the grocery store, yes, but if you're going to see a doctor maybe once every 3 months, every 6 months, it's worth the trip if you find the best doctor, and I think I have found the best doctor. So, okay, so now we've gone through two things. What else do you have?
So, we always have the latest and greatest with sinus. A lot of people have sinus headache. A lot of people have congestion. A lot of people have recurrent sinus pressure. So, the whole thing with medicine is, can we treat these conditions where people can bounce back quicker, faster with less repercussions. So a lot of things are moving more office-based. So I see a lot of patients have difficulty breathing in their nose. I see a lot of patients with those sinus headaches. So there's a lot of simple things I can do. And a lot of things I'm talking about today, that's not for everybody. These are not blanket treatments. It's if you are a perfect candidate, this is a great result for you. But there's times where patients come in, they hear about these balloon sinuplasties or turbinate reductions, and I decline them because the last thing I want is a patient coming in saying, I saw that Joorabchi guy, he did this procedure on me, it didn't work, I don't even know why I got it. Yeah. I hate that, and I hear that message, and that's against my whole mantra. Right. I'm a teacher and I'm a doctor, and so when you come through with my office, you're going to know why we do these things. So back to the sinus thing, I always tell patients I'm like a plumber. If you think of your sinus like a kitchen sink, think of it like a kitchen sink drain. All I got to do is get that drain flowing again. And I'm first going to try with behaviors, meaning, are you dusting? Are you a perfume junkie? Are you around chemicals? Are you bleaching more than you should be? Little behaviors I start kind of slyly probing while we're making jokes and laughing, right? Then we go to the exam piece. Are there signs of allergy? Are there signs of scarring or chronic infection? And if I can't get you there with medicines, then we start going for testing. So going towards what I was first mentioning, the balloon sinuplasty, basically it's dilating your drain. So if you imagine a kitchen sink drain that's the size of a straw versus a kitchen sink drain that's the size of a PVC pipe, which one drains better? Which one's more likely?
The big pipe,
right,
of course, not
right,
the little thing you have
right.
in your nose.
Which one's more likely to clog up?
Right.
So it could potentially clog up in the PVC, but it's going to take a lot
Yeah.
more. So we can actually dilate the sinuses in the office, and I've perfected it in the sense of painlessness. I've been tortured by the dentist all my life, and I've come to realize it meant something because it's made me be more empathetic for my patients. So I've been working with a pharmacist as far as making a special concoction that's going to give me, I'm like a mad scientist sometimes, decongestion effect and anesthesia. And we kind of came up with the conclusion, if I leave these medicines for 30 minutes, it's going to be as equivalent as any sort of injectable, any sort of sedative anesthesia, and the patients aren't feeling a thing. So I'm able to achieve this dilation painless. And it's the same stuff I use for the Clarifix drip, the Clarifix procedure, the runny nose procedure. It's the same concoction. So, and that's the whole thing. If you get this nasal drip procedure and you're like, we're listening to music, we're laughing, joking, there's no pain, it's a positive experience. If you said, I went to this guy, he was screaming, crying, bleeding,
right,
and he was yelling at me to sit in the chair,
yeah, no,
then it
you're
doesn't
absolutely
work.
right. So I do have a question. When I go to your center,
Mm-hmm.
there's a mixed group of people, the elders and the babies and everybody in between. What are you doing for the children?
Oh gosh, so I'm a dad of
Generally.
3. I love kids. If I could go back, I probably would have been a pediatric E.N.T. My dad's a pediatric cardiologist, so I think it runs in our blood. I don't know, it's a very it strikes a dad figure in me that I'm being very protective for these kids. So I'm very happy.
What are they coming for?
I'll see a 3-day-old kid for tongue tie. So if they're not getting a good latch for breastfeeding, it's breaking down mom's boob and they're losing weight, then there can be a very simple fix for me to just snip the tongue.
I just heard about that on
Yeah.
NPR. All right,
Yes.
so that's a child.
So that's one.
All right, what are other things?
Then the next thing is nasal congestion. Sometimes kids have trouble breathing through their noses, and it starts to strike around 4 months. So I assess the nasal airway, I assess the oral airway, and see what can I offer, what can I do to help there. Then the next spike is usually around 18 months for ear infections. So I'm a plumber again. The kitchen sink drain is the middle ear. The main drain is the eustachian tube. And I got to see what's clogging up that eustachian tube. And is it medicines? Is it genetics? Do I got to put in what's called an ear tube in there? And after that, then around 3 to 4, it's tonsils and adenoids.
I was going to get to the tonsils. It
Right.
sounds like, do you have your tonsils?
I do.
I have mine also.
I wish I got them out though.
Why?
When I went through medical school, so I had a rough ride when I was 19, studying and just getting sick a lot when I was a pre-med. I probably got tonsillitis 4 times in a 5-month time frame. And so I developed what's called a chronic infection in my tonsils. And throughout medical school, I would get it recurrently. So chronic infection, so our immune system, it basically puts these bacteria in jail, right? And there's some bacteria that gets fully destroyed with antibiotics, some that are resistant, and our immune system puts the resistant bacteria in jail. Now, so the jailers are like the antibodies, right? Anything that weakens your immune system will take away the jailers. So stress, poor sleep, another cold. These are little things that, if you haven't had a night's rest, then the jailers go away. Then the resistant bacteria come and play, right? So that's what happened. So that kept happening to me in medical school where, we're doing these 24-hour shifts.
Sure.
And so I had limited quality of life where now I'd be going on rounds and I have a sore throat on top of being tired. So it would have been a good measure for me to future-proof my body. But I'm at a good place now. I think it's leveled out. The body can heal. People don't realize the body can heal if you're patient enough. But my patience took about 16 years. And I probably took some damage along the way in a sense of taking antibiotics. People don't realize when you take these antibiotics, you're killing off gut flora for 2-3 years. It's not just weeks. So if you're changing all that stuff in there, what is it going to do to the rest of your body? They say the stomach is the second brain of the body, right? And if you're monkeying with that, so now knowing what I know, I'm a little bit regretful, and I wish it would have just got him out age 19.
But tonsils play an important part, I guess. That's why they're there. So if you're not having any problems with them, they shouldn't be taken out.
Well, I would argue they did have a lot of problems with the number one. So that's a very good question. So the tonsils, what do? They filter the airway, and they also are a source of immune cell production. When you get sick, they swell because they're acting, they're getting to work. Now, if you have those chronic infections, it's been shown, or that chronic bacteria, it's been shown that these tonsils create faulty cells. The cells that are being produced to fight infection are non-functional. So it's taking body resources and making these cells, and you're harboring these bacteria that are resistant, and it's making you get treatment. So it's a body work. It's a story. At what point does it make sense to get them out?
So is this an in-office procedure? You have to go to the hospital?
No.
It's a hospital.
This one is, I'm not going to say this one's nothing.
Hospital.
This one is not fun to go through. And I tell everyone that. If you want it, you got to get it, and it's going to make you pay. But no one is regretful after they get it done. If they decide to commit through and I scare them enough and they still persevere, that I know that they really want it, it's going to affect their quality of life in a positive way.
Well, I don't have a tonsil problem, and I just want everybody to know, again, this genius guy, he's got so much personality, and this is Dr. SINA JOORABCHI. That's JOORABCHI. And he deals in all sorts of ear, nose, throat, allergy, facial, plastic problems. And he's in Pembroke Pines. And the phone number, I'm going to give you that again. Remember, Pencil Talk Radio, it's 954-438-7171. Well, I know that you've, this is wonderful for you to come in live on a Saturday morning when we've got the Instagram going, we've got Facebook Live going, and YouTube. This is going to get on YouTube. So we're covering all bases with you. But you're just, so you love what you do, and that's what I see in your face and your smile. You're so happy, and you're always looking for new and creative ways to make people feel good.
I'm always, I have a lot of residents that I teach. If you come to my office, there's usually 2 or 3 residents are with me, and the first thing I say is tap into your passion. It's going to put out a good product if you tap into your passion. What strikes a chord with you, pay attention to that, and just keep digging. Because the passion is going to push you through when you're tired, cranky, sleeping, you're not sleeping, your kids are screaming in your ear, not letting you sleep at night. That's the thing that's going to keep you going, keep you smiling. That's why I think I have fun, because I'm enjoying. If you do it, look at you, you're beaming, you're smiling, you're doing what you're doing.
I love this.
And this is your passion, it's clear. And if you tap into that.
And the new issue coming out.
Yep, that's right. That's right. So I always preach, you got to do what you're passionate about.
Well, I'm so happy that you were able to come down here, and we only have a minute or 2 left, but tell me what your children's names are. You might as well get a little public PR for them.
I'd love to remember my kids in one.
You should have. That's what. Next time you do that,
they would have torn the place up, but I would love to.
How old are they?
7, 4, and 2. So maybe they're a little bit old.
Maybe the 2, but 7 and 4 would be okay. We get them to sit down and maybe even get them on the mic a little bit.
Jaden's my oldest, then Devin is my middle child, and she's my daughter, and Athens my youngest. So they all.
I remember when he didn't have any children. I remember. I don't think so. When I first met you, I think your wife was probably pregnant.
I had one, and we were negotiating the second.
Oh, that's what, okay. It was something I remember. Well, it's great. You know, people really have fear of physicians. You're kind of, they don't know enough about you and what's he going to do to me and all, but that's why I love having you come on the show, because you really show who you are. Your personality comes out, and being smart comes out. I'm always amazed that doctors who are so good some are so articulate as you are. It's such a pleasure, because, I mean, you probably didn't take public speaking or any of those courses. But it's just there. You're smart and you're good, and we're happy to have you a part of Boomer Times.
I'm happy to be here. It's so much fun. Yeah. It just flows. It's
Thank
so great
you so
being
much.
Here.